Eyebrows are an essential part of the face. Their absence will catch everyone's attention and will make a person feel at times as if they are being observed, affecting their self-esteem. Treatment through a hair transplant to repair this defect is the key to obtain a natural result if done by experts. In 1914, Crucis in Germany performed the first eyebrow transplant. In the 1930s, Tamur pointed out that the units to be used in this type of transplant should be single hair follicular units in order to assure naturalness. Nowadays, almost 50 years later, we keep on searching for the best harvesting techniques to obtain the follicular units and for the most adequate type of hair for this kind of transplant. The goal of this video is to consider alternative donor sites to the scalp to get follicular units with equal survival and the most similar texture and rate of growth to the native eyebrow hair. Traditionally, the grafts used to make eyebrow transplants come from the scalp, the strip being the most often used technique. But this hair has different texture, colour, and also a different rate of growth than the hair from the eyebrows, which requires constant grooming. FUE technique allows us to get follicular units from almost any part of the body, and from our experience so far, it is the forearm that has brought us hair that is closest to our objectives. The video shows FUE technique extraction from the forearm with a 0.7mm punch, implantation in the eyebrows with implanters, and post-operative evolution. Reviewing the literature, we have found that the most commonly used extraction technique for eyebrow transplants is FUSS, with subsequent skeletonization of the grafts into single hair follicular units. Many of the articles we have found describe the scalp as the only viable donor site, always using hairs from behind the ears or the lower occipital area where we find finer follicular units. Some publications mention the use of a superficial temporary artery flap. The scalp hair gives us a clear aesthetic result, although not so much from the flap technique, but it requires subsequent maintenance as the patient will need to cut the implanted hairs every 2 to 3 weeks. Some surgeons have begun to use the FUE technique, but the majority use hairs from the scalp, mainly from behind the ears. Thanks to the fact that the FUE technique allows us to extract hair units without leaving any scars on the donor site, we can search in each individual patient the body area which produces hair units most similar to the colour and texture of the native eyebrow. Taking into consideration the difference in the duration of the anagen phase between scalp hairs, which is 2 to 5 years, and eyebrow and eyelash hairs, which is 3 to 5 months, then we can explain the lengths reached by each individual hair. Another advantage, and not a minor one, is that by extracting the follicular units individually, we can obtain the exact number of units necessary from the donor site, therefore wasting less and leaving more units in the donor site for late extraction if required. In the case of male transplants, and in spite of only a little experience, we have seen that the closest hair in terms of texture, colour and even growth comes from the forearms. In female patients, this donor area can seldom be used due to little natural hair in the area, but as an alternative we can evaluate legs, thighs and the aforementioned area behind the ears. A good advantage of extracting the units from another part of the body is not only aesthetic but also the fact that it requires less post-operative care, which is particularly useful for male patients as they don't groom their eyebrows as female patients would. FUE can improve our results in a minimally invasive way by letting us reach follicular units from all over the body. It is important to evaluate each patient to find the best option of donor site in each case, feasibility of extraction, and survival of these units. Initial results are promising.